Hi, and welcome to Talkin Sports. Today we have a special guest, Dr. Marc Pietropaoli, who has actually patched up so many of us as athletes out there. It's going to be an honor to have him here and talk about sports and injuries. It's nice to have you here.
Thank you, Ormie. Thanks for
you.
inviting me, and it's an honor to be here with a local legend in a
We appreciate you taking the time to do this.
very nice
really do.
Auburn Legends room.
Well,
It's
thank you.
impressive.
By the way, I have a guest book over there. Sign it when you leave.
I will do that.
appreciate that. Yeah. Let's see. What encouraged you to become a sports medicine doctor and an orthopedic surgeon? What was that chain of events that got you to there?
Well, I think, as I tell people, there was three things that I wanted to be growing up. It was either a sports medicine doctor. I played music as well, so either a rock star or a fighter pilot. So those were my three things that I wanted to be growing up. And my eyes, I have contacts in, but my eyes were not good enough to be a fighter pilot. And I don't think my parents would have let me pursue the musical career. But if I put as much time into that as I put into being a physician, I think I probably could have been pretty successful. But
Before you leave today, would you mind singing a song for us?
I don't sing, but I'll
You
play
don't
the
sing?
drums, no
okay.
problem.
Oh, okay.
Drums, piano, things like that. But yeah, as far as becoming a physician, my father, his brother, my Uncle John, is the original Dr. Pietropaoli, so he kind of was my mentor and role model, and I looked up to him, and I liked the biology, and I liked fishing and cutting things apart, so I kind of knew I wanted to be a surgeon. And then I also liked sports quite a bit, so I told my uncle, I said, I want to be a sports medicine doctor. He said, well, if you're going to do that, first of all, it's very hard to get into that field, but you also have to be an orthopedic surgeon. So that's kind of how I got the idea of what I wanted to do. And certainly as I pursued it, I knew it was the right career for me.
Where'd you go to school when you were growing up?
I went to Gates Child High School in Rochester, New York. I'm from Rochester. And then I went to Syracuse University, and that was when the Pearl was there, and Derek Coleman, and Sherman Douglas, and all those guys.
Shot at the half court.
That was the year before I was there, but I got to
okay.
see them beat Patrick Ewing the following year. So that was
That's great.
fun. It was a good time to be there at Syracuse between 1984 and 1988. And then I went to medical school, which was 4 years. That was in Syracuse. It's now called Upstate Medical University.
Right.
And then I did my orthopedic residency, which is another 5 years. I did that in Syracuse. And then I was privileged to go down to Birmingham, Alabama, and work with Dr. James Andrews, who, if you watch ESPN, he fixes up a lot of the most of the professional athletes. And it was a great experience to do my sports medicine fellowship down there. And then I came back to Auburn.
Well, that's great. I got to tell you this from a personal standpoint. You recall that it was about 9 years ago you took care of me, but I have had 4 hip operations, and that combined pain was not anything close to when I had a tear in my shoulder. And he operated on me, this good-looking gentleman here, and I'm going to say 3 days after the operation, I felt like a new man because I could not sleep at all anymore, and you did a great job.
Well, thank you.
And I'm sure there's other people out there would like to thank you also. So
Well, I appreciate that, but the patient has to work hard as well. So obviously you
true.
did a good job in physical therapy, getting yourself back. So
We tried.
it's a team effort.
Oh, good. Yeah. Well, I'm going to go back to that first question. Is there anything else you want to cover about that?
Well, the thing I like about sports medicine and being an orthopedic surgeon is, I liked any field of medicine. When you go through medical school and you do your residency, you kind of get an idea and a little sampling of everything.
Right.
And I do like taking care of people and getting them better. And I think orthopedic surgery and sports medicine allows me to do that more than some other fields. Some other fields you can't really get the patient better. You may be able to help a little bit. You can't cure their problem sometimes. Whereas, as you said, you tore your rotator cuff, which is a tendon in the shoulder.
Right.
I was able to repair that back down to the bone. We were able to get it to heal. You did your rehab, and you're doing well. I can't always make everybody perfect, but we can get people. I can get people back doing the things they want to do, and it's very satisfying.
You do a great job doing it. So,
Thank you.
sports in high school. What did you play?
Well, I played Soccer was probably the sport that I played the longest and the most.
Right.
And in Rochester, soccer was very, 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 very big.
Right.
It still is, I think.
Right.
And I think that was because there was some type of a scandal in the 50s with football. So soccer was very big. There's also a lot of Italian immigrants, and I went to Gates Chili, so there was a lot of Italians there, and
Right.
a lot of soccer. So soccer, I also played a lot of golf, and then I played a lot of other sports as well. It wasn't like it is now where, I have 3 kids, and they've played a variety of sports, but it gets more and more where kids are playing only one sport, or they're specializing, I think, too much, to be honest with you.
Right.
So, I played baseball. We didn't have, my favorite sport was ice hockey, but we
That's
didn't
your
have
favorite
that.
sport? Oh, yeah.
It was.
Okay.
And so we had floor hockey. My dad coached that. My brother played it. It was a lot of fun. But hockey was always my secret sport that I wish I had played. But, I did anything from water skiing to snow skiing to fishing, and just a variety of things, which I don't think kids have as much opportunity to do
That's great.
nowadays.
That's a great mix you got right there. You mentioned scandal. You think there's any scandal left in football? I mean, with all the air in the football and everything else, they're kicking around. It's hard to believe,
I guess we'll find out more,
I guess we
I
will.
guess we'll find out more. But
Yeah.
still, that was a great game.
No, it was.
That was a great
Absolutely.
game.
I think the coach wishes he had just sent Marshawn through the line with that 1 yard, but
Yeah.
he'll live with that for a long time, unfortunately.
Yeah.
So. What are some of the most common sports injuries that you see during the winter sports season?
During the winter sports season, well, I think just during any sports season, we see a lot of ankle sprains. That's probably one of the most common things we see.
Yeah.
I certainly see a lot of knee injuries. And some shoulder injuries. I think when you get into the throwing sports like baseball, softball,
Right.
that's when we start seeing a little bit more of the shoulder
Shoulder
and
type
those
stuff.
types of elbow injuries. Although, again, people are practicing and playing all year round. I've seen several baseball players, pitchers, and during the off season with elbow and shoulder problems recently, because they're still throwing in the off season. Probably when they shouldn't be sometimes. You
Right.
need some rest from throwing. You can't throw all year round.
Absolutely. Yeah, that's a good point. You mentioned hockey. Locally, Auburn's having a little problem financing their hockey rink. My son happens to take care of it, Ormie Jr., and so he keeps me abreast of what's going on. But thank God the Skinny Atlas at least has 2 hockey rinks over there, so if anything happens here, maybe we'll be over to visit you. So,
They
yeah.
claim they're going to build another one as well.
Yeah. A third one?
Well, shut down the old Allen Arena and then
Oh, I see.
build another
Oh,
one at
okay.
the community center.
I got you. There's always a lot of humor in anything, but can you recall anything humorous in your operations or anything that can be told without a lawsuit? Steve said he'd pick up the lawsuit if he had any problem with it. So.
Any humorous things in the operating room? I think.
Doesn't say have to be
Well, I
operating
think
room, it can be-
it doesn't. I think when you're in the operating room, people maybe they think it's completely serious all the time, and it's not. It's
Right.
not always completely serious. You focus on what you have to do, but it can't be so rigid that people are always on edge. So you have to have some
Relief.
humor. We listen to music in there, not
Right.
blaring loud or anything like that. I'm not playing the drums or anything, but just things like that to keep the mood light. So there's a lot of banter. I have a great physician assistant named Josh, and there's a scrub tech named AJ, and amongst the 3 of us, there's a lot of banter back and forth. Some of which I could probably repeat, some of which I probably
I
couldn't. But
understand.
it's for the most part very, very still very professional, and we know what we got to do, and each person knows what they have to do, and just like it's a team, just like any sport, and the teams that are too tight sometimes don't play as well. So being a little bit loose and having that banter back and forth sometimes makes you forget about the stress of what might be going on and helps you concentrate better.
Okay. Before we get too far into it, maybe we should talk just a little bit about your family, because if you don't mention your wife and your kids,
That's right.
I think that's very important. So maybe you'd want to interject that now. So.
Yeah, I have a funny story about my wife. I guess I could tell you how I met her and all that, but we can go over that later if we have time. But yes, I have a wonderful wife, Christina. Beautiful, wonderful, great. And I have 3 wonderful children. My daughter Alexandra, who is a senior at Skinny Atlas, and she plays soccer and she plays softball. And she's going to be going into physical therapy at Northeastern, Doctor of Physical Therapy program, which is a very prestigious program to get in. So I'm very proud of her for doing that. And she's going to actually spend her first semester in Greece because she wanted to spend a semester abroad. So we're very proud of her. And then my son, Marc Jr., who was born on the same day as me, September 23rd. Yeah. So we had no choice but to name him Marc Jr. And he's a junior at Skinny Atlas High School. And he plays basketball right now. He's playing for Skinny Atlas. They're having a good season. And then he plays baseball.
Right.
He used to play football. He had a couple concussions. Maybe we can talk about that, those types of things later on as well.
Okay.
He's not 100% sure what he's wants to go into. Maybe law. He's not really sure, but we're starting the. We just got done with the college process with my daughter, and now we're going through it with him. So we'll be visiting a lot of colleges, I'm sure. And then I have a 9-year-old. She just turned 9. My daughter, Isabella.
Right.
And she's in 3rd grade. And she plays a little bit of everything. She's playing basketball and she's playing soccer. And I'll be coaching her softball team. So I've done a lot of coaching over the last 10 or 12 years.
That's quite a family. Yeah. Speaking of coaches.
Oh, I can't forget my dog, Duke, by the way.
Please bring your dog.
He's a Bernese Mountain Dog. He's big. He weighs about 120 pounds, so I can't forget him.
What was the breed?
Shout out to Duke.
What was it?
Bernese Mountain Dog.
Oh,
so
okay.
they're big, furry dog, black with kind of some white and
probably doesn't eat much, right?
Yeah, no. He loves the snow, though. Oh my gosh, he just loves it.
We have a little dog. We have a little silky terrier, but he just loves to go out and ramp. But the problem is the snow is far higher than what he is,
Yeah, Duke is so big and his chest is so broad that he just plows right through it. So they were meant to walk up and down the the Alps. That's what they were bred for.
Oh, wow.
So he loves the snow.
That's great. Yeah. Let's see here. What do you think there is growing trend of increased injuries in youth athletes? What do you think is causing all this?
Yeah, that's a great question, and that kind of is basically what I was alluding to a little bit earlier, where when I was growing up, there wasn't really as much specialization in sports, so we got to sample a little bit of everything and use different body parts and different muscle groups throughout the year instead of just using the same thing over and over and over and over again. And obviously, if you keep using something over and over and over again and don't give it a chance to rest or heal, it's going to break down. So I think we see a lot more overuse, stress-type injuries. We're seeing injuries that we saw in maybe college or professional or even further along at the youth level now, like the Tommy John surgery. The ulnar collateral ligament is the elbow along the inner side of the elbow here, and when people throw, put a lot of stress on it. And we're seeing injuries to that at the youth level, which was never seen before. And so I think that the over specialization too early is one of the problems leading to these injuries. I think playing 3 sports is a good thing. Or not playing. If you just want to play one, then giving yourself at least 6 to 8 weeks where you're not playing that sport or doing that activity during the course of the year. And you can do other things to stay active, but maybe not do the exact same thing. So I think the over specialization and the year round is not good. I've seen a lot of tournaments where kids are playing 4 or 5 games in one day. And, if the professionals don't play 4 or 5 games in one day, why are we having kids play 4 or 5 games in one day? I just don't think it's good.
Good point.
So those type of things are leading to probably a little bit more of the stress injuries or the injuries that we would see later on in somebody's career.